Hello, my dear candidates. How are you all? And hoping all are practicing well and really it's appreciating the mock session score is also good. Performance always it's helped me to evaluate each candidate's weakness. Even many candidates I see and I notice they are inactive. It's mean they are killing by themselves. That means I don't have any power to assess them. They already join in my course. There is some fish issue, some subscription issue. So best to be active. So it is for yourself, not myself. I am here for guide purpose. That's it. Try to show me what is your score, and what is your weakness, where you are confused. This is the platform for this, and my best research, inshallah, until now all are passing. And my 45-day course, always I emphasize that this course cover all. Okay, before or after, even few candidates join later, they will take some scope for next session. It is my review will be there. But the thing is that try to be active. Okay, though few days remaining for ending my session. So today's psychiatry session, dharma session is not small. It is very large session. Try to keep concentration because it will help me to understand every candidate. Psychiatry and dermatology session. In psychiatry, mainly this question asked in hard exam, not so common in DHA exam. DHA exam common part postpartum blue, people psychosis, neither commonly from hard exam they ask or ACL exam and Qatar candidates. They ask from the psychiatry part. Dermatology plus minus for the DHA. Even a few candidates give feedback they didn't get any question from dermatology, but hard ACL other candidates OMSB whatever they want to give, dermatology must. Okay. So whatever the plus minus we have to know very well because question I have to mark correctly. So postpartum blue, postpartum depression, postpartum psychosis. Very highly important topics for the exam. Postpartum blue always emphasize on the duration. Okay. And postpartum depression along with psychosis. So duration is very highly important. We have to know and we have to differentiate either is it psychosis or depression or blue. Just I always emphasize shortly I have to remember those things. So what is that? Blue means patient develops psychosis or this tearful, low mood, anxiety, always crying, okay, irritation within after birth of the baby within 3 to 7 days of childbirth. Resolve within first week. So postpartum blue, my dear candidates, DHA candidates and MOS candidates, try to be listen carefully. And this notes very high notes for the exam. Just try to listen. Blue within 3 to 7 days after birth of the baby, and it will resolve. No medication needed. 2 to 3 type of question they ask many way from the blue. How you will manage its reaction? Did any drug needed? Or what are the presentation, what is the diagnosis, okay, this way. Postpartum depression, low mood, loss of pleasure, anxiety, disturbed sleep, loss of concentration, suicidal thought. Depression leads towards suicidal thought, occasional thoughts of harming baby. This question, commonly asking question, that mom want to that this is not my baby, it's really horrible to me, I don't want to take this baby, like that way. Okay, self, not this is self harmful, it's a baby, the attitude is the harmful to the baby. So it will take 3 to 4 weeks, so it's a weeks. Shortly remember, blue is the day, depression towards the weeks, and psychosis towards the more than weeks, or I say always it's a month. Okay. So depression patient need medication. Exam question DHA candidates, MOH candidates. So cognitive behavioral therapy need for treating depression patient, and this option stay in the exam question. Postpartum psychosis need sometime admission and antipsychotic. Okay, mood stabilizer, electroconvulsive therapy. Depression thoughts harming towards the baby. Hearing voice means elation, hallucination, delation. So this full pictures towards the psychosis. My another point, the duration. It will be appear after weeks. I say it's a month. So if you shortest this point, that blue means day, 3 to 4 days after birth. Depression means week, 3 to 4 weeks after depression. Psychosis, you can say, ma'am, delation only for the psychosis. Yes, it is only for the psychosis. Even if you see the elation, delation, this is psychosis. Even if you don't want to remember the duration, is okay. And the management, electroconvulsive therapy, high yield question for the exam. Postpartum, one way to differential baby blue from the natal depression. I already discussed duration is a very high yield point for the differentiating. This is blue within 1 to 2 days to week, and depression 3 to 4 weeks. I already discussed this point, very high yield points. Now discussion. Discussion will be rapidly, or it's not a towards the topic wise, but a question. This collection PDF I said very important, and discussion will be more clear. Okay. So first question will be discussed with me, Dr. Anjana.
Good evening, ma'am.
Good evening.
30-year-old female delivered her baby 1 week ago, presented with crying bouts associated with decrease in appetite, self-neglect without any clear reason. What is the possible diagnosis? A. Postpartum depression. B. Baby blues. C. Generalized anxiety disorder. So, ma'am, I think it is just 1 week and crying bouts. So, more towards postpartum baby blues.
Yeah, excellent. Excellent, Anjana. Yes, it's a blue. Thank you, doctor, for understanding. It's a clear conception. Thank you.
Ma'am.
Second question will be discussed with me, Dr. Ikra.
Assalamu alaikum, ma'am.
Walaikum assalam.
19 years old female, scared from dust storm. She gets out of home with her family during sandstorm. She get inside the bed and cover her head with pillow. What is the most likely diagnosis? Generalized anxiety disorder and social phobia. Ma'am, I think it's A.
So, Dr. Ikra, try to understand what they said. They said scared from dust storm. So, you are scaring from the dust storm or your patient. So, she gets out of home. She gets out from home with her family. During sandstorm, she get inside. When the storm sends, she get inside bed and cover. So, these are specific social phobia.
Phobia.
This is specific one episode or one like you your patient telling you, ma'am, I really very afraid to going to the market, going to the any shopping mall, going to or seeing any cinema like that. They say this is a sandstorm,
Okay. Yes, ma'am.
sandstorm, and cover the head with pillow. Still the storm didn't yet started, nothing. Just as she gets out and the scared. This is the
Uh,
one type of episode for the dust storm. Okay, they
yes,
didn't say the storm started, so it's a one type of one episode social phobia. Okay,
ma'am. Yes, ma'am. Yes, ma'am.
so third question will be discussed with any question, Dr. Ikra, or clear?
No, ma'am. Yes, ma'am. Yes, ma'am. Thank you.
Yeah. Third question, Dr. Donilda. This is a hard
Yes,
question.
yes, ma'am. 27-year-old male, after 12 months on war, he saw dead friends. and remembers difficult situations. He is low mood, poor sleep. What is the most appropriate treatment? A is sertraline, B is lorazepam, C is amitriptyline, and D is lithium. I feel it is sertraline.
Excellent. Cause this is a
Uh,
post-traumatic stress
yeah,
disorder, right?
yeah,
Mister?
PTCD, yeah, stress, PT,
So,
yeah, post traumatic,
yeah, PTSD,
PTSD, huh, PT,
post-traumatic is stress disorder, and first line drug is SSRI. It's the sertraline.
sertraline, yeah, okay,
Thank you.
thank you. Okay.
Fourth question will be discussed with me, Dr. Saba Jisan.
Assalamualaikum, ma'am. Uh,
Alaikum.
Fourth question. Adult female complains of lower abdominal pain since 4 months. She says previous doctor told her that she did not have any disease. She had been examined and did abdomen, urine, pelvic investigations and all and were normal. What is the most helpful in this situation? A. Refer to the psychiatrist. B. Frequent follow-up visits. C. Perform exam and under uh, order investigations. Ma'am, patient have a psychiatric issue, so we will refer her to psychiatrist, and the answer will.
Yeah, this is a psychiatric issue. We have to refer the patient in the psychiatrist a clinical scenario. Patient complaining of lower abdominal pain for 4 months and already investigation done, which reveal normal. Again, patient complaining for these symptoms. So this will be helpful via referring the psychiatric evaluation, Dr. Saba, right?
Yes, ma'am.
Yeah, thank you. So the question regarding the agoraphobia, that's explanation shortly. I want to discuss the fear of anxiety regarding a place from which escape might be difficult. It can be most disabling of the phobia because it can significantly interfere person's ability to function inward. So what does it mean? A specific phobia. And and thinking is a challenging to escape from this phobia or escape from this situation, and try to accompany it with friend, try to accompany it with family member, and don't want to leaving the home like this, and try to crowd, and this is a fear from the crowded place, closed place, and avoid this kind of place. Okay, that's where the agoraphobia question, commonly asking question. Duration: if more than 6 months, symptoms will be fear or anxiety plus public transportation, open space, confined space. This will be the picture for the scenario. Second question exercise, Dr. Donilla nicely explained, it's a post-traumatic stress disorder. We have to select SSRI. And fourth question from Dr. Saba, it was the psychiatric evaluation needed. So after death sign, or anybody if after death, first denial sign, then anger sign, then bargaining sign, then depression and acceptance. These are the stages for if any after death of the any person or any relative, the stages, the denial, acceptance, bargaining, depression. Okay, so denial is a, what is that? That avoidance, confusion, elation, shock, denial, and can't understand or can't accept this situation. Denial. It is, and you are telling the he is dead or he is not. He's passed away, and trying to either anger or bargaining. Okay, and it will take time for depression. Okay, 2 to 3 time, 2 to 3 months to take time. Okay, so these are the presentation they ask by frustration, irritation. This is the anger, bargaining. Okay, reading out, shouting, bargaining. These are the presentation. So we have to do, or we have to give emotional support, guidance, and direction. Okay. psychotic disorder, doctors, commonly few words we have to face when we do psychiatry study. What are the words? Delusion, hallucination. So, this psychotic disorder characterized by significant impairment, reality testing, including positive symptoms, and it is associated with these positive symptoms, delusion or hallucination, which with or without insight into their pathological nature. Disorganized behavior, formal thought disorder, delusion. So fixed or false belief, delusion. So hallucination means perceptual expression without, what is hallucination? Without external stimulus. So there is the anhedonia, evolution, like and telling that there is a snakes, but there's no snakes. Trying to say a person trying to kill her, but there's no one trying to kill her. So false belief. And illusion is a false scenario, false object. Okay. Schizophrenia criteria, we have to understand that brief psychotic disorder associated with elation, deletion, which is at least 1 month or less than 6 months, persistent or stay. Schizoaffective disorder, deletion associated with hallucination 2 or more weeks in the absence of major or more episodic during lifetime duration. So shortly, if I say one point, we have to understand that schizophrenia associated with behavioral changes, deletion, hallucination, and associated with the duration. If it is more than 1 month or within 1 month, it is schizophrenia, but schizoaffective disorder within 2 or more weeks, we can say schizoaffective disorder. So first question just for discussion will be discussed with me, Dr. Sneha Raj. First question regarding postpartum psychosis.
Yes, ma'am.
Yeah.
Regarding postpartum psychosis, A. Recurrences are common in subsequent pregnancies. B. It often progresses to frank schizophrenia. C. It has got good prognosis. D. It has insidious onset. E. It usually develops around the third week postpartum.
So Dr. Sneha, here psychosis, right? I am
Yes, ma'am.
telling 1 point, though it's not good, just telling here 5 options, but 2 options correct. And I am giving the instruction that tell me which 2 options are correct.
Ma'am, so according to the notes, it usually develops around 2 to 4 weeks after delivery. So maybe E is correct.
Okay, accepted.
Uh, and C, it has got a good prognosis.
No, it's not good prognosis because it may recurrent. If
It often
anyone,
progresses to frank schizophrenia.
Ma'am, it's A. Recurrence are common in subsequent pregnancies.
yes, it's the A. It's the A. Okay. Sneha,
Okay.
it's a it. If anyone facing one episode, this psychosis in postpartum, it's recurrence. Okay. So the
Okay, ma'am.
answer is A and E. Okay, doctor. Okay.
Okay, ma'am.
Thank you. So this second question will be discussed with me, doctor. Okay. Clinical scenario, sometime in exam we will face actually DHA question. Dr. Somia, what is the answer? Paranoid schizophrenia answer?
Ma'am, it's B.
It's the clonazepam, right? It's the
Yes.
clonazepam. But
So,
actually, in paranoid schizophrenia, what we give? We can give clonazepam, but it's typical. It's typical.
yes, ma'am.
We use atypical first. Which one atypical? Just tell me.
Say,
I'm giving instruction. Which one atypical?
C. Ma'am, I think
Mm-hmm.
B is the typical, B
Mm-hmm.
is atypical, and C is typical.
Again, your word kindly.
C is a typical, B is atypical, as I
No,
know.
no. Clozapine is a
Okay.
typical. Okay. Just
Okay. Okay.
it's not issue that the thing is that flufenazine, flufenazine is an atypical antipsychotic drug is a best choice to start. Okay. If no choice in flufenazine, you answer because this question two-way in DHA exam question. There was no flufenazine option on clonazepam. Clozapine is the option, so answer was clozapine. That's why I put this question because many candidates face this exam question and whose exam in DHA. So remember, if atypical antipsychotic not in and after my session, I'll post typical and atypical drugs so you can review those drugs. Flufenazine, atypical antipsychotic. Clozapine is the typical, and we use common in resistant psychosis. Whatever the thing it is, we have to use first atypical. If it is not in the option, I have to choose clozapine. Clear, doctor?
Okay.
So which is a very high topic for the exam. Somatic symptom and related disorder. Somatic symptom means what? Multiple symptoms involving multiple system. Chronic course, history of excessive diagnostic testing, rejection of previous physicians. So complaining of I have headache, I have abdominal pain, I have hand pain, multiple, I can't see anything, multiple symptoms. Multiple symptoms means what? Try to understand this is direct question MOH candidate that what is the diagnosis they ask. So multiple symptoms, multiple system. My hand, my eye, my head, my heart, chest pain, my abdomen, multiple symptoms. Chronic course, I'm telling this is for 6 months, it is for 1 year, I can't sleep, I can't do anything. This is the chronic course. History of excessive diagnostic testing. And I'm telling ma'am, I'm doing this excessive, this is the test, and no one can find out any diagnosis. Please do help me like that way. Excessive test done. Rejection of previous physician that I checked this physician, but they didn't do anything. So all are rejected. So uh, first they ask the diagnosis and treatment is the psychotherapy. Okay, this is a direct question. Somatic from somatic syndrome is even it was my exam question. That's why I post and this question was the what is the diagnosis? Multiple symptoms, multiple systems, and what is the diagnosis? Hypochondriac or illness anxiety disorder. Hypochondriac means what? Hypochondriac means constant thinking of acquiring or having a serious illness that I am thinking I have a HIV, I have a cancer, constant thinking, a huge, a major illness, a serious illness, and I need medical evaluation and reassurance. So, no somatic symptoms that no, I am not telling that I have head pain, I have back pain. No, this hypochondriac means just one word. It's say I'm telling you I have a cancer, I have a myocardial or I have a heart attack. Like that way, this layman term they will use. And I can't see. I am sudden blindness. I'm facing terrible that way. So hypochondria illness, we have to give cognitive behavioral therapy. This also recent MOH exam question. Cognitive behavioral therapy for hypochondria illness. So see, psychotherapy for the somatic disorder, hypochondria disease, we need cognitive behavioral therapy. Hypochondria disorder example C, a person believing that a simple headache is because of the cancer. Because of the cancer, simple headache. A person thinking tiredness is due to HIV. A person believing benign lump is a cancer despite all investigation, all are false. So these are the hypochondria. My dear can still not what I am telling, what I am discussing, every podcast, every topic is the exam question. Okay. So Munchausen syndrome, intentional production, falsification, fabrication. What does it mean? I am intentionally producing, like I am drawing with red color my in hand for a bleeding tendency. It's a fabricated, my hand or my leg is a fabrication. Psychologically, I am impaired. So it's intentionally I am producing that I am killing myself or I am hurting myself by this any kind of knife, but it is not the fabrication. Okay, this is the Munchausen syndrome. Not so common. Just try to understand. Even sometimes some question they ask what you don't know. So there's an example, a women always present to the hospital. See what I said. Complain of abdominal pain, bloody stool. So complaining of pain and stool bloody. She brings a sample from home. It's a fortification. Okay, falsification, which contain blood but is not able to produce a stool sample with the in the hospital. So when the patient come from the home and the stool associated with blood, but in hospital there is nothing like that. This is the fourth time she has visited in the hospital. Her abdomen show multiple scar. Why multiple scar? Because she done fabrication, laparoscopic surgery for showing that I have scar, I done many scar, I have abdominal pain, I have surgery and many things. All are false. Insist on getting more investigation. So Munchausen syndrome is the fabrication, intentional producing our symptoms. Okay, Munchausen syndrome by proxy. Okay, it's a factitious illness. Okay, conversion disorder. Try to understand that conversion disorder means loss of motor or sensory function. So a patient come to us is a common exam scenario for the heart candidates. Try to understand this scenario. Paralysis, blindness, mutism. I can't talk anything. I can't see anything. I can't move my leg. These are the loss of motor sensory function. These are the also a form of fortification or falsification without any organic cause. So, which is triggered by the stressor. Okay, which are the triggered by stressor and patient do not intentionally fabricate the symptoms. So, conversion disorder, okay, somatiform disorder, Munchausen syndrome. I discussed very important topics and also this hypochondriac syndrome. My dear candidates, all topics need to be clear. Somatiform means multiple symptoms, hypochondriac means serious illness, conversion means sudden telling I can't see, I can't move my leg is a paralysis like presentation. So there's example. See, a 25-year-old female was brought to the hospital with limb paralysis that developed after the witnessed a car accident. All examination are normal. A woman presented to hospital that is she is unable to see after witnessing the death of her husband. All examination are normal. Okay. Anorexia nervosa is a high yield topic for the MOS DHA heart candidates. Try to understand very carefully and most 80 to 70% chance of getting a question from these topics. Anorexia nervosa or bulimia nervosa. So anorexia nervosa, significant weight loss due to food restriction. Significant weight loss due to food restriction, excessive exercise, self-induced vomiting, excessive exercise, self-induced vomiting, laxative or diuretic use. My dear friends, my strong recommendation after my session, I will post everything. Try to understand, try to solve question. I'll post psychiatric file, two files. One is the theoretical, another is the question file. Fear of getting observed even though the patient is thin. Okay. The fear of getting obese, callus on the hand due to induced vomiting. Due to there's a callus and BMI below 17.5. So that will be the callus in the hand due to induced vomiting. There is a fear of getting obese. So this is the anorexia nervosa. Anorexia nervosa management is that refer to medical ward for stabilization with any BMI. Like, I have to admit the patient if patient present to my hospital with hypoglycemia, bradycardia, electrolyte imbalance. Okay, BMI below 15 means we have to admit this patient in eating disorder unit. Okay, BMI within 15 to 17 means without any medical complication, we have to again refer to the eating disorder unit or local community mental health team. So if you are considering admission, we have to remember blood pressure and pulse rate, like bradycardia, low pressure, we have to admit the patient. So see the scenario, a patient BMI 15 to 17 and there is system failure, there's eating disorder service and psychology. So we have to kindly mute the mic. It's really not good that if you do unmute, okay? It's really not acceptable. Okay. So see, we have to remember that we have to shift the patient in eating disorder unit. Bulimia nervosa. So bulimia nervosa recurrent episodes. Okay, recurrent episodes. So recurrent episodes of binge eating, compensatory mechanism to lose weight, fasting, excessive exercise. So compensatory mechanism, recurrent episode of binge eating, excessive exercise, self-induced vomiting, laxity, parotid swelling. Every point they will post in the exam, they will give the clue for the bulimia nervosa. This is the DHA frequent asking question. And BMI will be the more than 17.5 and we have to give the cognitive behavior therapy. Autism spectrum disorder, developmental impairment of social and communication skill, stereotype and repetitive behavior, preference for only specific hobbies. Okay, so autism spectrum disorder, behavior and developmental program we have to give, and speech and language therapy. Just remember that there is a developmental delay or developmental impairment for communication skill and stereotype repeated behavior disorder. So you have to give the behavioral therapy, developmental program therapy, and speech and language therapy. Okay. Asperger syndrome, just shortly, it's the IQ will be the average and above average, whatever thing, high functioning autism, it's the autistic, difficulty with socializing. First question will be discussed with me, Dr. Hira Abrar. If Dr. Hira able to talk with me, neither is
Yes,
okay.
ma'am. Yes, ma'am. Assalamu
Yeah.
alaikum, ma'am. A
Salam.
54 years old man presents with a variety of physical symptoms that have been present for the past 9 years. Numerous investigations and reviews by a variety of specialists have indicated no organic basis for his symptoms. This is an example of nutrition syndrome, hypochondrial syndrome, dissociative disorder, somatization disorder, conversion disorder. Variety of physical symptoms that have been present for the past 9 years. Numerous investigations reviews variety of specialists and more than this for symptoms. Ma'am, it's somatization disorder, multiple
Excellent.
symptoms.
Excellent. Excellent. Thank you, Dr. Hira. Second question, excellent. Second question will be discussed with me, Dr. Kishori.
I'm here, ma'am.
Yeah.
25-year-old man demands a CT scan of his abdomen in clinic. He states it is obvious he has cancer despite previous negative investigation. This is an example of hypochondrial disorder, conversion disorder, Munchausen disorder, syndrome, dissociative disorder, somatization disorder. Man, the answer is A, hypochondrial disorder.
Cause? patient complaining of
Because
she
ma'am,
has this.
yes, he, like some kind of serious illness. He thinks
Yeah,
that yeah,
yeah, serious illness. So it's the hypochondrial disorder. Thank you, Dr. Kishore. So this way nicely performed by my candidates. So it is that evaluate that all are nicely listening. So try to be active. So attention deficit hyperactivity disorder. This question I search out. This question 2 times appear in hard, 1 time, another 1 time is the MOS. And SLE I feel so 1 time, but it's a very long days back. So today one candidate give SLE exam. Alhamdulillah, she give nice feedback. Maximum repeated question. Really, it's feeling good. So attention deficit hyperactivity disorder, hyperactivity impulsivity and or inattention. So symptom present more than 2 setting before 12 years of age. Okay. So attention deficit disorder, it will be before 12 years of age or ongoing school babies, okay? And it will present more than 2 settings, reluctant to engage in mentally or challenging tasks. So excessive talking, remember this word, excessive talking, easily distracted. Attention deficit means there is attention difficulty. Either the baby will do hyperactivity or inattention or excessive talking, okay, and but there's no concentration in anything or any focus work, does not seem to listen, does not, you are talking like you are telling, can you write for me a, or can you tell me a rhyme, but not listening your word when spoken directed to, so you are talking but the baby is not listening, failing to finish school work and course because she is or the baby is not attentionally activated. So children, we have to give first line therapy methylphenidate. Attention deficit disorder focus group parent training program. This is very important. They ask how we will manage. 1 time they ask, I face the recall. Parent training program we have to give adult lisdexamfetamine or methylphenidate we have to give first line. So lisdexamfetamine, this is not exam, this still not they ask. Methylphenidate they may ask. Cognitive behavioral therapy. Listen very carefully these words, okay? This another question will be discussed with me, Dr. Shruti.
Okay. 6-year-old boy was brought to the hospital saying that he's easily distracted and injures other students in the school. He's also careless, unable to stay on a task for a period of time, and is unable to play quietly. What is the most likely diagnosis? Ma'am, it is attention deficit hyperactivity disorder because the student is before 12 years of age and he is
Mhm,
easily distracted and
mhm,
he interrupts others and he is
mhm.
not able to uh,
And unable to play
unable to play
quietly.
quietly. Yes.
Yeah, excellent. Thank you. Thank you, doctor. So manic disorder, mania means elevated mood and increased quantity and speed. So what is mean? Mania means hyperactivity or mood elevation, mental activity more than 1 before this declaration of a mania patient. You have to keep observation till 1 week or more than 1 week. That mood are elevated, speed of the physical activity are more than normal, mental activity are the haphazard or higher activity. So diagnostic required functional impairment, functional work will be impaired. Okay. Grandiose idea means what? Funny ideas or high thoughts ideas. Grandiose, that the idea thinking is not related to reality. It's a grandiose ideas. Excessive amount of energy, racing thought, flight idea, okay, overactivity, needs little sleep, easily distracted, okay. So this associated can be distinguished from the mania to hypomania. In hypomania, there will be the hallucination and dilation, but in mania, hyperactivity. So hypomania is the milder form of the mania associated with marked, okay, does not cause marked. So hypomania less severe than mania. It's not so marked functional impairment, and hypomania we can differentiate from the mania by hallucination and delation. Okay. So this question will be discussed with me, Dr. Sharmin Shahid. It's a Miss Semivis.
Yes, ma'am. A patient describes the sensation of having an increased turnover of thoughts in his mind. What is the most likely thought disorder? Flight of ideas.
So why flight of ideas? Cause
Ma'am, because there are no features of schizophrenia and ADHD in this, and
but
there is a
the
rapid
idea
turnover of
increased
thoughts.
turnover thoughts. Yeah, it's a flu. The increased turnover of thoughts, the increased turnover, frequently turnover the thoughts, frequently changing the minds, right, Dr.
Yes,
Mavis?
yes.
Oh, thank you. So depression, one of the following associated with constant low mood, loss of interest. Okay, constant low mood, loss of interest plus fatigue, worthlessness, suicidal thought. So these are the signs when I will declare as a physician the patient is depressed. So I have to find out at least 2 to 4 signs along with more than 2 week presentation if patient insomnia, if patient feeling fatigue, suicidal thought, if before declaration it will be persist more than 2 weeks. So management obviously and DHA question they ask the management. So cognitive behavior therapy. Antidepressive if cognitive behavior therapy failed, I have to give SSRI. And it is the first line is the fluoxetine, sertraline, and commonly they stay in the option sertraline, citalopram. Okay, so sertraline mainly. So first cognitive behavior therapy, second sertraline or fluoxetine. We have to continue this drug 2 to 4 weeks, and medication can be continued at least 6 months. This time here also my exam question. Chronic mild depression. This was really a typical question, the chronic depression, and I have to mark this question by excluding method. It is not this depression, it is not schizophrenia, but patient chronically depressed. It's a more than 2 year, even it is a long history. My DHA exam, patient's father was that I was thinking it's a grief or it's a depression. That's 6 months back. Patient's father dead 6 months back, and I also thinking the regarding the 6 months, but the presentation is for more than 2 years. So it is associated not the grief or the anxiety or the depression or acceptance, but chronically patient is depressed and mild depression. Now there's no suicidal thinking, there's no weight loss, but patient fatty, patient low mood, and I am associating with this. Is this associated with the father's death or not? Associated with this acceptance or not? That's a very long scenario. Okay, so I was just excluding method. I was keep marking this time here. Okay, so 2 to 4 question you will find out like that. Dr. Today's SLE candidates given exam that told me that maximum was a repeated question. Few question was not so typical. So it will be few questions cannot be typical, so no need to be worried because I have to get 65% mark. That's it. Okay. So depression regarding this question. So I already discussed this question: weight gain, loss of appetite, or increased appetite, low mood, hypersomnia associated with atypical depression. So remember the cornerstone treatment is psychotherapy. Following that, if antidepressants are required, it's the fluoxetine. Okay, and adjustment disorder. Just see, this is the question. This question can be discussed for discussion. Dr. Fatima is here or Dr. Shruti? Anyone? Okay. Try to read the question and answer the question.
A woman has been feeling low and having difficulty in concentrating since her mother passed away 2 months ago. She feels lethargic and has been crying more often lately. What is the single most likely diagnosis? Adjustment disorder, grief, asthenia. And I think it's adjustment disorder uh, because recently she lost her mother and she started having a difficulty in concentrating and lethargy and frequent crying.
So it is not
I
grief,
think
it is not asthenia, so it's the adjustment disorder, right, doctor? Excellent.
yes,
Thank
ma'am.
you. So this way we can understand it's not grief, because grief will be not persist so long. It's within 1 or 2 weeks. Okay, grief. Bipolar disorder, mania. I already discussed hypermania or hypomania. Alternative with depression, mood stabilizer, lithium. Exam question. Mood stabilizer for the bipolar disorder is a lithium. Okay. So see, example, a 40-year-old female came to a hospital. We spent a huge amount of money. Okay, spent a huge amount of money on buying a new accessories and clothes. She goes out with friends almost every day. She sleeps less than usual and tends to feel her way with numerous activities. And 4 years back, she was on medication for depression. So see how mania it is. This female buying clothes, accessory every day, going towards the friends and taking everything, but the sleep duration is very low. And 4 years back, the husband, there's a 4 years back, there is a history of this medication for the depression. So all goes towards the mania, high thoughts. Okay. So bipolar disorder associated with mania, depression. These are the two words. Remember, hypomania and episodes of the depression. If you just see depression or mania, it is not bipolar. Only if it is depression or mania, it's not, but both. So see, there is a nicely chart. Mania and depression both, if it is associated with bipolar. So you patient first, the example, patient buying clothes, buying accessories, and goes towards the friends and a maximum time spending by friends with numerous activities associated with from 4 years patient taking depressive medication. So all goes towards the bipolar disorder. So see what they are. If only mania or only depression, it is not bipolar disorder. Lithium toxicity medication, I mean general medicine question, very important. They ask commonly by course, stream or side effect. Drowsiness, hyperreflection, they don't ask, they ask commonly pharmacological question, course, stream side effect. Diuretic and NSAIDs can cause lithium toxicity by increasing renal reabsorption. So I have to manage by IV fluid, stop the drug immediately, and hemodialysis. Okay. First question will be discussed with me, Dr. Reza Oruzi.
Yes, ma'am. A 32 years old man is brought to the emergency department by the police. She was found preaching outside the local supermarket, telling people that she's a god, discipline, and has been sent to prevent them from wasting money. It transpired that she has also spent up to her limit on her bank card. She began a treatment with fluoxetine some 3 weeks ago for reactive depression and after splitting from her husband. A limited physical examination due to poor compliance is unremarkable, as is a routine blood screen. Which of the following is the most likely diagnosis? A spent of money, she was depressed, and I think she had two poles. It must be psychotic depression, Munchausen syndrome, schizophrenia, viral encephalitis. It must be mania.
It's the mania, right?
Yeah.
Bipolar disorder, right?
Yes.
because
Yes,
she
yes.
has both. Okay, thank you, Dr.
Yeah.
Reza. You done well.
Welcome.
Second question will be discussed with me. Dr. Tamanna Taharim.
Hello.
Yeah. Doctor?
Yes, ma'am. A 62-year-old man is brought to the doctors by his daughter. 4 weeks ago, his wife died from metastatic breast cancer. He reports being tearful every day, but his daughter is concerned because he is constantly picking fights with her over minor matters and issues relating to their family past. The daughter also reports that he has on occasional described hearing his wife talking to him, and on one occasion he prepared a meal for her. Despite this, he has started going walking again with friends and says that he is determined to get back on track. Okay, 62 years old man is brought to the doctor. His wife carefully fitted, but his daughter is concerned because he is constantly picking fights with her. Because that he has an addiction, describing hearing his wife talking to him and preparing meal. Okay, typical Filipino depression of success, depression of psychotic, delusion, depression. Ma'am, it's a normal grief reaction.
Excellent. You are just not really excellent. Just I am waiting what you are thinking. Thank you, Dr. Tamanna. You performed very good. Thank you.
Yes, thank you.
It's a normal grief reaction. So, lithium toxicity. If a patient on lithium comes with vomiting, coarse tremor, they ask directly blood vision, polydipsia, drowsiness. So it's a polydipsia means it's a nephrogenic diabetes mellitus. Just remember, my dear candidates, lithium toxicity very high topic for heart candidates, for DHA candidates. Why? They ask from polydipsia, polyuria, it's a nephrogenic diabetes insipidus. Blood vision, costumes, lithium toxicity. Two way they ask question. Very carefully remember this way. So dehydration, okay, lithium toxicity, renal impairment, we have to pick the lithium toxicity. Okay, so we have to keep the rehydration. If dehydration, renal impairment, these are the causative factor for having lithium toxicity. The deletion, I already discussed this false belief, sustain, deletion of jealousy, deletion of grandiose, deletion, belief, exaggerated self-worth, innovative neglect. Okay, just remember the definition, because what image can do, sometimes they face only one or two questions, because some question will not be with our knowledge, but if we know very well, it will be excellent. Delusion of jealousy, grandiose delusion, inherited neglect, delusion of guilt, persecuted delusion, and Agbor syndrome. From these six category, just remember, delusion of jealousy means believing a partner is being unfaithful. I am thinking my husband is unfaithful. This is the delusion of jealousy. Grandiose delusion means belief of exaggerated self-worth. Exaggerated self-worth, I am overconfident that I am superhero, like that way. Grandiose delusion. Unilateral neglect means believe that one limb not exist. It's a unilateral neglect. Okay, delusion of guilt is that I am responsible for flood, I am responsible for this storm, so I am guilty. I'm feeling guilty. This is the deletion of guilty. That's it. So these not all are not so important for the exam. That's all definition here persists. Just I am keeping all. But if anyone can try to know the definition. Thought disorder associated with schizophrenia, thought insertion, thought withdrawal, and thought broadcasting. I am telling my thinking are broadcasted by TV. My thinking are broadcasted by internet. This is the thought broadcasting. I am thinking that my thinking, my planning are stalling. all are stolen down, all are my thinking. It is not how they know, like this is thought withdrawal. Okay, so these are the schizophrenia. Hallucination already discussed, auditory hallucination and voice saying I am walking, second person you are walking. Okay, these are the hallucination. These are the visual hallucination. Schizophrenia, just remember diagnosis, we have to record two symptoms, either delusion or hallucination or disorganized speech or disorganized behavior, negative symptoms. So flat affect, social withdrawal, management, atypical antipsychotic, my dear kind of schizophrenia, very high topic, either they ask what is the diagnosis or what is the management, my MOH candidates. My MOS candidates management, risperidone, olanzapine, depot injection is not important, but they ask definitive management is electroconvulsive therapy. Definitive management. So side effect of antipsychotic, weight gain, akathisia, dystonia, tardive dyskinesia, very important. Atypical antipsychotic, many very important topics is that tardive dyskinesia is the side effect of the antipsychotic drugs. Schizoaffective disorder, just remember schizoaffective mood disorder associated with schizophrenia. Schizophrenia from cause this exam question. Just shortly remember schizophrenia means what? Disorganized speech, disorganized thought, hallucination, or there's illusions associated mood disorder or mania. This is the schizoaffective disorder. Schizophrenia from disorder associated with schizoaffective disorder, which is persists till 6 months, is schizophrenia disorder. It is not really hard to remember, my dear. I'm telling you honestly, really very easy. Try to revise this note one or two times. That's enough for marking correctly from the psychiatric question. So this question will be discussed with me, Dr. Dr. Priya. Okay, Dr. Priya, if not here, this question will be discussed with me, Dr. Rehana.
Yes, ma'am.
Ma'am, I'm there, ma'am.
Okay, then Dr. Priya, yeah.
Okay. Good evening, ma'am. A schizophrenic man is brought to the emergency department and is agitated, making threats is considered a danger to others. How should he be managed? I am haloperidol or I am lorazepam. I am morphine. I am Perkinil. Ma'am, option A, haloperidol or lorazepam, ma'am.
First patient is why? Patient is
He's
agitated.
agitated, ma'am. Yes, ma'am.
Yeah.
It's making threats and considered danger, so to calm.
Yeah. Yeah. Thank you.
Thank you,
Thank
ma'am.
you. So second question, doctor, I was asking another candidate whose name I just announced. Doctor, after Dr. Priya,
Rehana, ma'am.
Rehana, yeah, Rehana, yeah. This question.
When a person known to have a history of Parkinson's disease or dementia with Lewy bodies has acute psychosis and is elderly, what is the most appropriate medication
Very
to
important exam
administer?
question. Very important. My MH candidate, very important exam question. They ask directly. A patient, just give me a 1 minute. A patient Parkinson disease associated with dementia and associated Lewy body means what? Parkinson associated with any delusion or hallucination is called Lewy body. And patient develop acute psychosis. And what is your management? So, Dr. Rehana, what is your management?
Acute psychosis. IV haloperidol.
Okay. It's a Lewy body dementia, acute psychosis. Okay. Patient is not agitated, restless for haloperidol to calm down. No, it's not. We have to come down another way. If patient agitated, restless, we can do haloperidol, but another way I can cool the patient. What is that? And
I
in
am
Parkinsonism, okay, I am lorazepam is the answer. Another way, if patient, known case of Parkinsonism, very important part is that we can't give haloperidol in Parkinsonian patient because it already causes rigidity. If I give haloperidol, it will exacerbate the rigidity. Okay. So haloperidol indication is, thank you, Dr. Rehana, you done well, though you are confused, but the thing is that haloperidol we can't give Parkinsonian patient. Okay, we have to cool the patient by lorazepam. Haloperidol indication C, there's schizophrenia, acute delirium, rapid control of severe psychomotor agitation, persistent aggregation, restlessness, confusion. These are the indications. Very important. DHA heart emotion, very important indication. I have to understand this is the emergency medicine question. Acute psychosis, acute agitation patient. I will calm down the patient by haloperidol if it is not Parkinsonian patient. If Parkinsonian this clue is there, I can't give haloperidol. That's it. So say do not use in Parkinson's disease, dementia, Lewy body dementia. We can't use in haloperidol patient. First question will be discussed with me, Dr. This Umesh Shahajad.
Yes, ma'am.
Yeah. First question.
20-year-old male keeps counting blocks, walls. He keeps repeat counting. He feels guilty and anxiety when he stops counting. What is diagnosis? Depression, obsession, and compulsion. Ma'am, it's option B, obsession.
It's excellent. Thank you. Why? Because repeatedly doing and same work, right? Keeps
Yes.
counting the walls. He keeps repeat counting. So it's an obsessive compulsive disorder. Thank you, Dr. Oman. Okay. Second question, if it is means no issue, just for discussion. Second question will be discussed with me, Dr. Nandini Sharma.
Good evening, ma'am. Yeah, patient known to have a panic attack. She described her last panic attack as if she was not in the world. What can explain her symptoms? Illusion, derealization, depersonalization. Uh, Ma'am, I think it's derealization.
Excellent, excellent done. Thank you, Doctor. You have done excellent. Third question will be discussed with me. I'm very fast because I also touch on the dermatology. Third question by Dr. Monir. Dr. Monir, if Dr. Monir is here. If no,
Yeah.
okay. Yeah.
A schizophrenic man is seen laughing and smiling about his father's death, whom he liked, loved, and respected. What term describes his body language? Incongruent effect, disorganized behavior, delusional effect. Disorganized behavior?
Actually, it's a one type of disorganized behavior, but in this case is schizophrenia. This behavior name is determined is incongruent effect. Another type, but the stay the option. The term we have to remember is incongruent effect because it's not matching with the speech. The patient is laughing, smiling about his father's death, which is not associated what he is doing. Okay, so remember that incongruent effect means patient affect does not match the content of her speech. Full normal range of variability, mobility is a depersonalized that determining that it is a disorganized behavior, not it is disorganized, but it is an incongruent effect of the schizophrenic patient. Okay, doctor, clear?
Okay.
Okay. So okay. So see, this is transpolarization. Just remember the agitated men can come with medical history unknown, a medical history known. So if medical history known, we have to give the lorazepam, haloperidol. This is the stabilization step of the management. If patient come with medical history unknown, we have to manage by lorazepam. If patient come to my hospital with unknown history, known history, we can give haloperidol. Like as a patient Parkinsonism, I can give haloperidol. I have to use lorazepam. That's way this tranquilizer method, and I have to evaluate this way. This panic attack presentation, remember very well, this panic attack patient is arise rapidly, peaks within 10 minutes, can last 40 minutes, palpitation, trembling, sweating, shortness of breath, chest pain. These are the panic attack symptoms. So management is breathing through the back. What they ask in the exam? In panic attack question, I heavy or I am neurological. SSRI for the long time. Do it, two question in the exam question. Two question can ask by panic attack. Initially how will manage and definitely long term management. So generalized anxiety disorder, this is excessive anxiety or a 6 month at least associated with trembling, shaking, constant worrying, sleep disturbance, irritability. Management is cognitive behavioral therapy and SSRI. This question will be discussed with me. Dr. Monia is here. I hope Dr. Monia will perform this case. Dr. Maha Umer.
Yes, ma'am. 18-year-old sprinter who is currently preparing for a national athletics meeting asks to see the team doctor due to unusual sensation in his leg. He described a numb sensation below his knee. On examination, the patient there is apparent sensory loss below the right knee in a non-dermatomal distribution. The team doctor suspected non-organic cause of his symptom. This is an example of conversion disorder, hypochondrial disorder, somatization disorder, malingering, and Munchausen syndrome. Ma'am, I think somatization disorder.
Which one?
Ma'am, option C.
Why? What they said? Can tell me one by one, ma'am. These are the options like others. Tell me.
Ma'am, if the patient think hypochondrial disorder, if the patient think that he has cancer, then we would go with option B. Ma'am, this is an example of, I think, conversion disorder.
It's the conversion is excellent. Okay.
A option, ma'am. Yes, ma'am. A option.
Okay, thank you. So don't do hurry. Okay, don't do hurry. Try to understand. No, don't do hurry.
Yes,
second question will be discussed with me, Dr. Dr. Mehwis.
Yes, ma'am.
Yeah.
A 24-year-old male is admitted to the emergency department complaining of severe abdominal pain. On examination, he is shivering and rolling around the trolley. He has previously been investigated for the abdominal pain and no cause has been found. He states that unless he is given morphine for the pain, he will kill himself. This is an example of not the hypochondrial conversion. Somatization disorder.
Again, read and tell me the point.
24-year-old male is admitted to the emergency department complaining of severe abdominal pain. He is shivering and rolling around the trolley. He has previously been investigated for the abdominal pain and no cause has been found. He states that unless he is given morphine for the pain, he will kill himself. This is an example of it can't be hypochondrial disorder because there is no serious illness he's saying.
Okay.
Conversion disorder,
Mm-hmm.
and there will not be a conversion disorder because there is no organic cause, I think, malingering.
Okay, I will discuss. Dr. Kishori, what is the answer?
Ma'am, I think, ma'am, this is really, I think, tough, but I'll try, ma'am. What about, ma'am, hypochondrial disorder, ma'am?
My hypochondria patient complaining of
I think
severe
it's
abdomen.
D.
It's
Is D, Murchison syndrome.
D.
Murchison syndrome is, ma'am, like
Uh,
falsification,
It's
fabrications.
fictitious, no?
malingering.
Malingering.
Because
It's
there
a
is
doctor is it's a
malingering
doctor.
because yeah.
Mhm.
Because there is a gain. There is a gain. He wants morphine. There is a gain, and this is malingering.
It's a malingering. Dr. Reza, right?
Yes.
So
Option
yeah.
C.
So option C is the answer. So Dr. Reza, tell why is option C. Explain it for all.
Because
Why
there is
not?
a
You will explain by why not bunch, because this exam question all how I have to remember, and I already discussed. You will tell why it's not hypochondrial, why it's not conversion, why it's not Munchausen. Okay, like that way. Tell me one by one.
Okay. Hypochondrial, in hypochondrial, the case think that there is a problem, for example, cancer for for him, but there is he doesn't think that way. Conversion, I think that in conversion, there is a problem without any reason for it. For example, paralysia without any reasons or in trauma or anything. These two options,
Blindness,
yes, these two
paralysis,
options, paralysis, yes,
external.
rule out. Munchausen syndrome, the patient fabricates something, but there isn't any benefit for the patient. There isn't any
Fabricated.
benefit.
There is a fabrication. There is
Yeah,
no
fabrication
fabrication.
make some problem without any gain, without any benefit. Then there is this case is not Munchausen syndrome, and somatization disorder also psychological problem convert to a somatical problem. For example, a person in distress get diarrhea or maybe
Multiple symptoms, abdominal
yeah
pain, without any
abdominal pain.
pain.
Yes.
Okay, frequent. So it's a malingering. So what are the point here? Malingering, Dr. Reza?
There is a benefit. There is a gain for malingering. For example, in this case, he wants morphine, and he tell that if I don't get morphine, I will kill myself.
Yeah. This is the point. Thank you. Clear, all doctors
Okay.
clear? Any point? Anyone? Any
Yes, ma'am.
confusion?
Clear.
Okay. So must to know, must to know. Must to know. There's no confusion with these topics. Postpartum, this hypochondrial conversion. In Alanor, the recall, but always I said this is the recall. There could be the wrongly in sequence, and the recall is recall. So these topics we have to know strongly. That's the point. So panic attack, panic disorder, and general anxiety disorder, there is a definition. Just remember that way. This panic attack means young women without significant medical history suddenly develop intense fear. Over the past 20 minutes, palpitation, sweating, like I'm going a wedding ceremony or any restaurant, I'm feeling palpitation. So it's a panic attack. Somehow, any episode. Panic disorder means above young women having attack, panic, and the panic disorder, recurrent panic attack goes towards, without any triggering factor, goes towards panic disorder. General anxiety disorder must at least stay within 6 months. So see, there is an example, a woman who has a constant excessive worry about daily activities like family, excessive worry like family, finance, housing, and the worry is almost one most days. She focused on possible negative outcomes. So this is the general anxiety disorder. Okay. So see, panic disorder, we have to do the ABG interpretation. We will find out high oxygen, low carbon dioxide, hyperventilation. Okay, over breathing. So it's a panic disorder. Okay. So presentation will be the anxiety Okay, we have to avoid the meeting, group events. And the management is the long-term SSRI or cognitive behavioral therapy. There is an example after the posting the PDF. Just remember, obsessive compulsive disorder. This question I already discussed with the woman. Obsession, unwanted, intrusive thought, pathological doubt, checking a door locked or no, the fear of contamination, repeated hand washing, repeated arranging things, repeated activities, management, cognitive behavioral therapy, SSRI. Post-traumatic stress disorder, I already discussed Dr. Donnie Love, re-experiencing, flashing back the traumatic event, avoidance situation, hyperarousal. So management is the cognitive behavioral therapy associated with eye movement, desensitization, reprocessing is EMDR, no need to remember. Remember this paroxetine and mirtazapine. Agoraphobia, claustrophobia I already discussed, and management is graded exposure, reduce fear response. So first this question will be discussed with me, Dr. Sneha Raj.
Yes, ma'am.
Mhm.
A 14-year-old boy is brought for review. He is normally fit and well and hasn't seen a doctor for over 5 years. His mother has been increasingly concerned about his behavior in the past few weeks. She describes him as staying up late at night, talking quickly, and being very irritable. Yesterday, he told his mother he was planning to take over the school assembly and give constructive criticism to his teachers in front of the other pupils. He feels many of his teachers are underperforming and need to be retaught their subjects by him. He admits to trying cannabis once around 6 months ago and has drank alcohol a few times in the past year, the last time being 2 weeks ago. Prior to his deterioration a few weeks ago, his mother describes him as a happy, well adjusted, sociable young man. Which one of the following is the most likely diagnosis? Hypomania, cannabis induced psychosis, mania, alcoholic hallucinosis, Asperger's syndrome. Ma'am, so it's definitely not Asperger's syndrome. Uh, um, and he said it's not cannabis induced psychosis because the usage was only 6 months back. Ma'am, mania?
Excellent. Excellent. It's the mania, right? First there is a
Yes,
two
ma'am.
episode. Patient is doing what are the two episode here, doctor? Why mania? Bipolar, depression, and
Bipolar, yeah.
hyperactivity, right?
Hyperactive, yes, ma'am.
Thank you. Second question will be discussed with me. The question is not so good, a little bit tough, Dr. Saba. Second question. If Dr. Saba is not here, second question will be discussed with me. Okay.
I'm here. A
Okay.
27 years old woman is brought in by her husband. She has been refusing to go outside for the past 3 months, telling her husband she is afraid of catching a avian flu. On exploring this further, she is concerned due to high number of migrating, migrating birds she can see in her garden. She reports that she reports that the presence of her husband socks on the washing line in the garden altered her to this. What is the most likely diagnosis? A depression, B hypochondrial disorder, C formal thoughts disorder, D borderline personality disorders, E acute paranoid schizophrenia.
Just
Ma'am,
Dr. Saba, even if you can't understand, try to excluding method. Okay. Even I just trying to instruct you. Okay.
ma'am, option A and B is excluded.
Okay.
Um D is also excluded.
Okay.
There is option E and C. And
Mm-hmm.
the most appropriately, the answer will be E. Acute
Excellent.
paranoid schizophrenia.
It's acute paranoid schizophrenia caused by the wife is afraid of catching avian flu for the husband, and she's concerned and high number of migrant birds, okay, from she can catch from the garden. So all are the paranoid schizophrenia. So this is the thinking of the mind, right? I always suggest my MH candidates, even if you don't know the answer, try to exclude your own self by excluding method. It will reach your in passing score. Thank you, Dr. Saba. So this question already I discussed. The anxiety disorder, shortly continuous anxiety, episodic anxiety, it could be the phobic anxiety disorder or panic anxiety disorder, it already discussed. Suicidal thought, self-harm, suicidal ideation, inter-planning, just risk factor, divorce, male gender, unemployment, these are the causology, and the protection like the prevention. Okay, this prevention will be the, we have to take the history, self-harm history. So we have to give the psychotherapy or cognitive behavior therapy. Okay. The storage syndrome I already discussed in pediatric. Okay, this is very important. Neuroleptic malignancy syndrome, hyperthermia, muscular rigidity, autonomic instability, haloperidol, risperidone due to potent close-up drug induced. Remember this question, commonly asked question, though they ask, and many candidates do wrong. I don't know why. Neuroleptic malignancy syndrome, hyperthermia, this nicely clue. Only this clue enough for reach the neuroleptic malignancy syndrome. But the candidates can't understand. I don't know what is the cause, and they either they give the drug value like risperidone taking, potent inhibitor, the close-up in flufenazine. This is the potent antipsychotic which causes neuroleptic malignancy syndrome. So, my dear candidates, listen very carefully. If any patient have history of taking haloperidol, risperidone, and taking and come to hospital rigidity, autonomic instability, sudden fall down, and you are examining the patient, you are finding this hyperthermia is neuroleptic malignancy. So this is clinical scenario. Also, okay. So also can be rare complication from the metoclopramide. Remember, every drug is the complication for the neuroleptic malignancy. I already discussed in the surgery part, but remember this way. Acute dystonia is a muscle spasm, stiffness, akathisia associated inability to feeling restless and inability to remain still. Okay. Tardive dyskinesia, involuntary movement of the body, and drug-induced Parkinsonism is associated with resting tremor rigidity. Neuroleptic malignancy and malignant hypertension differentiate must to know. Okay. Borderline personality disorder, just remember mood swings associated with self-harm. That's it. Antisocial personality disorder associated impulsive aggressiveness and criminal acts. So this first question will be discussed with me, Dr. Hira Babar. First question.
Yes, ma'am. A young man gets agitated and violent in the department. Medical history has yet to be obtained. What is the most appropriate medication to prescribe? A young man gets agitated and violent in the department. Medical history has yet to be obtained. What is the most appropriate medication to prescribe? Lorazepam, phenytoin, haloperidol. Ma'am, it's haloperidol. Hello?
Yeah. What is your answer?
Haloperidol.
Okay. So is that, doctor, why you are marking haloperidol?
Ma'am, because it's violent behavior and he's agitated.
Okay, so I will prescribe here haloperidol, right?
Yes,
Okay,
ma'am.
I'll discuss. Okay, thank you. Second question will be discussed with me, Doctor. It's a Doctor Donilda.
Yes, ma'am. Uh, Patient presented with hopelessness. Which of the following is likely to be with it? Gender identity disorder, impulse behavior, suicidal behavior, panic disorder. It's suicidal behavior.
Why?
Because it's showing, he's showing hopelessness. That is the
Excellent.
only thing I can.
Okay, excellent, excellent. Dr.
Yeah.
Donila, you've been excellent. First question, Dr. Donila, what could be answer? First question, can you read? This young man agitated, violent.
A young man gets agitated or violent in the department. Medical history has yet to be obtained. What is the most appropriate medication to be prescribed? To prescribe?
Mhm,
Yeah, it's
mhm.
haloperidol, I feel.
But
Because
medication, so see, they said one point, medical history has yet to be obtained. You don't know the
then
medical
it's
history.
lorazepam. I think it's
Lorazepam. It
lorazepam.
Lorazepam. Because when they
Patli.
say medical history yet to be obtained, when you don't know the medical history,
Lorazepam.
contrary,
Yeah,
but you have to be safe doctor. You have to be safe doctor. So answer is the
yeah.
Lorazepam.
Okay,
yeah. Thank you. Yeah.
okay.
Take
Thank
it.
you.
Okay.
Thank you.
Thank you. Mhm. So lysergic acid diethyl sansonite. Just remember, it's shortly this just for the discussion, not so important. Adjustment disorder I already discussed. The patient crying, sleeping, abnormal distress greater than the when we have to be expected response stressor. Okay, acute stress reaction. I hope today it's not possible to complete the dermatology. Just I will just 2 to 3 session. So last question will be discussed with me, Dr. Ikra. Last question. Then I will start dermatology and I'll clear the second session.
Yes, ma'am. 31-year-old woman who gave birth 2 weeks ago presents for review with her husband. He is worried by her mood as she now seems depressed and is interacting poorly with the baby. He describes her mood 3 days ago being much different when she was taking in rapid and incoherent fashion about the future. The mother denies any hallucination but states that the baby has been brought into a very bad world. What is the most appropriate management? Start fluoxetine, reassure and review by health visitor, cognitive behavioral therapy, start lithium and arrange urgent admissions. Ma'am, I think it's C, uh, cognitive behavioral therapy.
Dr. Ikra, I said you will read the question again and you will tell me what are the important points to think about.
31-year-old woman who gave birth 2 weeks ago presents for review with her husband. He is worried by her mood as he now seems depressed and is interacting poorly with the baby. He describes her mood 3 days ago being much different when she was talking in rapid and incoherent fashion about the future. The mother denies any hallucinations but states that her baby has been brought into very bad world.
So what does it mean, Dr. Ikra? Baby has brought very bad word. So it's a what? What is the diagnosis? Very bad word, baby. So what does it mean? What is the condition ongoing? Exam question. Okay.
Ma'am, it's postpartum.
2 weeks. So 2 weeks. So
It's depression. It's
but right now it's a psychotic stage. It's a psychosis. Cause
psychosis.
it's a very hallucination. It's elation, hallucination. Mother denies. I am telling I don't have anything. But my presentation, my symptoms all goes towards the psychosis. What you will do?
Ma'am, antipsychotics or mood stabilizers, C, fluoxetine.
This question, okay, I'll discuss. This question will be discussed with me, doctor. Okay, because this question is a very high question for the exam. Okay, Dr. Reza, do you know the answer?
Uh,
Yes.
Mhm.
Can I read again?
Yeah, you.
31-year-old woman who gave birth 2 weeks ago, present for review with her husband. He is worried by her mood. Then he had 2 weeks ago a birth. Then worried by her mood, and as she now seems depressed and is interacting poorly with the baby. He described her mood 3 days ago being much different when he was talking in a rapid, like mania, and incoherent fashion. Uh, Fashion about the future. The mother denied any hallucination, but states that her child has been brought into a very bad world. What is the most appropriate management? Then she has a psycho. She has psychos. We must start fluoxetine reassurance plus review by health visitor, cognitive behavior therapy, start lithium, arrange urgent admission. For psychos, we must admit the person because maybe the patient harm herself or maybe the others or maybe the baby. I think the best option is arrange urgent admission.
Excellent. Excellent done. Excellent done. Of all doctors clear why urgent admission need? Any confusion? Patient need urgent admission cause patient already psychosis state and patient is thinking is a very bad one. It will be harmful to the patient's baby. So right now patient need urgent admission. We can't treat this patient in OPD basis. No, no. Okay. So this is the very high risk patient. We have to do urgent admission. Thank you, Dr. Reza. Clear by all? Dr. Ikra, clear or not? Any question, any confusion?
Yes, ma'am, clear.
Thank you. Thank you, doctors. So I will discuss 2 to 3 topics from the dermatology, or if my candidates want another session, I'll take. What will be the best? Would I continue or I will take another session? Because this is long term, I'm taking the session. If my candidates want to continue, I can do, or neither I will take another session. Okay, it depends. Anyone can give any suggestion to me. If it's a continue is good or comfortable for all, then continue the discussion. I'll continue the discussion.
Take another session, ma'am, please.
Yeah, excellent. Because I think I am on feeling also we can do another session. So thank you so much, doctors. I'm ending my session. Assalamu alaikum to all. Tomorrow will be the last surgery session from the vascular part. Okay. Thank you, my dear candidates.
Thank you so much, ma'am.
Yeah. Okay.
Thank you, ma'am.